Do y'all know what is the worst part of UroLift is? I'm going to show you right now. Oh my gosh, this right here. Just from today. Incredible. Of course, I'm not going to talk about what's the worst part of the UroLift. I'm actually here to answer a question that one of the members on this Thriving Urologist Facebook group, Thriving Urology Practice Facebook group asked. And she asked this question about UroLift, and I figured this is something that may benefit a lot of us who are on this forum. Hello, my name is John Lin. I'm a private practice urologist. I also happen to be a center of excellence recognized by NeoTract in regards to the UroLift system. So this member asked, they are about to start doing UroLifts in their surgery center next month, and her doctor performing them has been doing transrectal ultrasound, cystoscopy, and uroflow on those who may be candidates. And her question was, do you do this as well? And I'm going to quickly go over how I see my BPH patients and how I work them up. So if it's a brand new BPH patient, when they make that appointment, we will try to get them to come in with a full bladder, do a uroflow, do a PVR when appropriate. And I do understand not everyone has a uroflow machine or can easily do PVRs. But that's what I try to do. I try to have them come in with a full bladder, do a uroflow, do a PVR. And before I even see them, once they do the uroflow and PVR, it's recorded electronically, the uroflow is. And then when they're roomed, my medical assistants will have them watch this thing right here. This is a video player put out by NeoTract. It's the UroLift BPH Relief Insight, and it's
66 years old and lives an active lifestyle.
It's what's called a Meet Mike video. It takes about 3-4 minutes. That's before I even walk into the room. The patient's already learning about BPH. The patient is already learning about UroLift. By the time I walk in, they already have a good understanding of what's going on, and these older guys typically already know before watching the video that they have something affecting their urination. When I go in the room, I'm actually the one doing the uroflow, the PVR. While I'm talking to the patient, I capture the PVR. So I'm actually doing the uroflow, I'm doing the PVR, and they're watching a video player. So I do the PVR and I talk about the treatment options. By then, they already know about UroLift. They already know about some of the other treatment options. And if the patient is interested in having the UroLift system performed, the next visit is when I perform cystoscopy and transrectal ultrasound. So the answer is yes, I do have the patient undergo cystoscopy and transrectal ultrasound because I believe that these are very important procedures to perform when you work up a potential UroLift patient. At that visit, when the patient comes in for his cystoscopy, I do both at the same time, cystoscopy and transrectal ultrasound at the same time. And if the patient is a candidate based on those evaluations, then I set them down and then we can talk about the procedure. But the important thing when you do cystoscopies is you're evaluating the prostatic urethral characteristic. If it's a very tall prostate, if it's a very lengthy prostate, and having done so many of these UroLifts and cystoscopies, I can estimate the number of implants that I need when I perform a UroLift at the time I perform a cystoscopy. I also notice if there is a median lobe. Of course, if there's a stricture or something like that, you obviously want to take care of that before any sort of a UroLift or ablative procedure. When I do the cystoscopy, I not only do I check out the length, the height characteristic of the prostate, I also note if there's a median lobe, and yes, there's a median lobe indication with NeoTract's UroLift. When I go into the bladder, I look at the characteristic of the bladder. Is it a flaccid bladder, trabeculations, are there stones, tumors? Very importantly, I think it's imperative for the urologist to retroflex the cystoscope so that you can look at whether or not there's any sort of intravesical prosthetic intrusion into the bladder. If there is, what does it look like? Is it just lateral lobe? Is it anterior lobe? Is it huge median lobe? Or is it just completely puckering into the bladder? Those make a big difference in regards to the way you approach this UroLift patient, whether or not you feel comfortable doing it versus some other treatment options. So once I take the telescope out, the bladder's still a little full. Transrectal ultrasound is going to be very easy. I know it's indicated for prostates less than 80 grams, but I know this is not in the NeoTrax guidelines, but what's more important to me is the width of the prostate, the hemilobe width, the lateral lobe of the prostate. If that lateral lobe is less than 33 millimeters, and I am talking off guideline, this is not the party line, this is not the guideline, but if the prostatic lateral lobe is less than 33 millimeters and the prostatic urethral characteristic is favorable, the bladder is very favorable, I personally will put the patient on for a UroLift if the prostate is greater than 80 grams. Now, again, that is not the guidelines, that is not what NeoTrack will tell you, but I'm just telling you what I do. Why 33 millimeters? Because the implant device will reach out 33 millimeters at its maximum distance to deploy the capsular tab. So that is something that I personally do. You can do whatever is comfortable for you, and your docs can do whatever is comfortable for you. So I do, the short answer is, I do cysto, I do transrectal ultrasound. Not only do I do a PVR, I will do a UroFlow and a PVR whenever possible, if permissible, if it's available in your practice, etc. Anyway, Nicole, Roscoe, Kashif, Sarah, Joe, and Edward, thank you so much for watching. If you have any questions, and if you're doing anything differently in your practice to work up these BPH and UroLift patients, let me know. I would love to hear about it. Obviously, leave any questions in the comments. And hope you all have a great rest of the week. Today, obviously, was UroLift Day. And yeah, the worst part of UroLift is all this plastic waste that I'll have to recycle. Have a good one, guys. Take care.